Assalamu alaikum dear doctor. In this video I am discussing about history asthma. Focus history asthma. So the scenario is that Sarah, she is 11-year-old Saudi girl. Known case of asthma. She came 3 days back with low grade fever, cough, wheeze and she received bronchodilator but not good improvement. Please take history to solve Sarah problem for proper management. Now, the differential diagnosis of poor control of asthma. The following very important to check in asthma. So, when we take the asthma history, these are the differential we think like poor compliance to treatment regimen, then incorrect technique or inappropriate device for child, exacerbation of bronchial asthma due to triggers. The triggers of bronchial asthma are smoking, pets, reconstruction of home, allergy trigger, stress that is physical or psychological, pneumonia, wrong diagnosis, maybe cystic fibrosis, gastroesophageal reflux disease, or congenital heart disease, and poor understanding of disease management. So, when we take the history, we'll ask about this disease and these triggering factor questions. Now, what to ask in asthma? Analysis of the presenting symptoms and related symptoms. The respiratory systems, cough, shortness of breath, musical sound induced by exercise. Also, we ask about CVS, CNS, urinary, and musculoskeletal system. Now, past history. Past history will ask for asthma when, where, and by whom diagnosed, and presentation at diagnosis. How diagnosed, investigations and procedure. Need any admission or not, and where ICU or ward admitted, need intubation or not, any more admission. What treatment given at the time, like IV aminophylline or salbutamol. Drug history will ask about that. What drugs given on discharge? Method of admission via spacer or how? And by whom given? How many times per day? Do you forget to take your exotid? And number of beta agonist and steroid in last year? Do you think steroid causing any side effects? And other drugs. So when we took the drug history, we'll ask all these questions and we'll search the as the patient is taking steroid, the side effects present of the patient or not. Follow up. Follow up is that any dietitian involved during follow up time, number of GP and hospital visits in last year, regular peak flow measure, diary for peak flow, best peak flow, any prick test is performed or not, any other previous illness, any surgical intervention, blood transfusion. So we will ask when patient admitted previously, is there for asthma the patient is admitted or any other previous illness present or not. We also history of allergy. We know it is very important history of allergies in history of asthma taking. So we ask about to any food. Is there any history of allergy of any specific food, drugs, rhinitis, hay fever, eczema? By this question we can find the triggering factor because suddenly the diet habit can be changed. The child have any food allergy like any peanut or egg allergy can be present. Drug, rhinitis, hay fever, eczema, all are the associated with asthma. Now, nutritional history and growth, we will ask what type of food and are you following weight and height? Is there any weight loss present or not? We will ask because we know that one of the important differential diagnosis of asthma is cystic fibrosis. So, we need to exclude. Birth history, we will ask about bottle or breastfeed and vaccination and development history in brief if time allow. Family history of asthma and atopy. Social history, that is very important. The social history, what we will ask, details of the housing, type of flooring, furnishing, measure to reduce mite dust, recent house move or reconstruction of the house. Smoking, we will ask that anyone in the family smoking or someone visit home smoke. We know that smoke is an important triggering factor or visiting someone smoke. Animals, pets, we will ask impact of the disease on the patient like schooling, activity, development, growth. So his school activity, school performance, how the impact of this asthma will ask. Impact of the disease on family, social deprivation present or not. Now, history in details. Now, what history I am now telling. First is general principles. Introduce myself. Hello, I am Dr. Emma Chaudhary, a registrar in pediatric working in this hospital. I believe that you are the mother of Sarah. Could I know your good name, please? Thank you for coming to discuss Sarah condition. So, first I will introduce myself. Then check for the patient and mother whom I am talking and then welcome I make a repo. Number 2 points for history is the chief complaints. So as a doctor I'll ask, I received letter from the GP that Sarah, she is known case of asthma and she developed fever, cough and wheeze. Am I right? So can you tell me more about this? So first we will ask an open question. Can you tell me more about this? Then we Hear the history. Then mother is telling, yes, you are right. Her temperature start to raise up and also develop cough and musical sound from her chest. Then history of presenting complaints will ask, and we analysis. If the mother mention on history like fever present, then we will analysis of the fever. How? For how long she has developed this fever, 3 days or 4 days, that duration she will tell. How you know temperature is high, which time of day it's increased, and is it sudden or gradual onset. So, what thing you did brought temperature down? No drug relieve it. Is there any drug that relieve the temperature? You notice anything make it more? Is it associated with any rigors or skin spot? Now analysis of cough. We know that cough also present on the chief complaint. So you told also associated with cough and difficult of breathing. Can you told me more about this? Nature of the cough. Is it dry or productive cough? If productive cough, what is the color of the sputum? Amount of sputum. Is it associated with blood? Now time of the cough. Is it more at night or during the day? Is her sleep affected by this cough? Is the cough more during specific time of the year? Frequency of the cough. If night cough, how much frequency you can have? How many times per week attack of day cough? Relieving and aggravating factor of cough. Anything relieving this cough? Anything made it worse? Or anything like exercise make the cough worse? So cough history will analyze its details. Now analysis of the shortness of breath. Is the cough associated with difficult of breathing? Is the difficult of breathing during rest or related to exercise? Is daily activity affected? How much exercise precipitates dyspnea? Is it associated with any chest pain? Is it associated with musical sounds from the chest? Then number 4 points of history is systemic review. The other system we will also discuss and ask that generally we ask about any concern regarding his weight, any concern of her activity. Here weight is important. We know cystic fibrosis once come, failure to thrive associated with cystic fibrosis. That's why GIT will ask about what about his appetite. Is she feel thick, nausea? Is she thrown up? That is vomiting. Any episode of aspirations. Vomiting is very important in asthma. We know that gastroesophageal reflux disease is one of the differential diagnosis. So we need to exclude. CNS will ask, is there any abnormal movement or headache? Urinary symptoms, any concern regarding her urine like pee, poo, any problem? Else also skin we can involve here, that any atopy, asthma, they later discuss on this book. Atopy, asthma, rhinitis, hay fever presents or not. We also ask about the hair visions like eye, any problem, any discharge from the eye, color of the eye changes, this type. Now number 5 is past medical history. How can we ask past medical history in asthma? I know that Sarah is known case of asthma. Can you tell me more about it? When she was diagnosed 4 years back. So where was diagnosed? Who diagnosed him? Is she need hospital admission at time of diagnosed or after that? What was the sequence of admissions at the time of diagnosis or after that? What was the diagnosis on admission? Was admitted to high dependency unit or ICU or the wards. What investigation done for her? They did chest x-ray and blood test. What medication received? Is she need to put her in breathing machine? Is she receiving any drug through blood tube like IV salbutamol or aminophylline? For how many days? 2 days. Is she need any more admission after that? Number of GP and hospital visit in last year. Now, number 6 points is that is she in regular follow-up? Yes. Who is following her? Pediatric pulmonologist. And what type of help offered? Are you doing regular lung function test? Peak flow meter. Did you having a diary for recording this reading? What is measurement of the last flow meter? Now number 7. They're telling other past history like atopy of the baby. She had any skin changes, eczema while Nada was infant. Yes, red cheeks with scratching she developed before any seasonal symptoms like runny nose or wheezy chest or red watery eyes. Did for her any skin prick test, history of any cystic fibrosis, congenital heart disease, gastroesophageal reflux disease. So all these points are involved in past medical history. Remember in number 5. Now I am telling 6 number history. 6 will mention drug history, compliance to treatment. What drug Sarah is taking, Ventolin inhaler, blue collar, how much she is taking, how times per day, is she use inhaler alone or by help of someone else, is she used directly or via spacer, can you show me Sarah how you use it, when last time does changed or adjusted, number of repeated prescriptions of beta agonist, not prescribed for you another inhaler, yellow or orange color Flixotid. If taking Flixotid, Sarah, did you ever to take your Flixotid? If yes, how often she missed? If she in any other drug, example steroid tablet, if taking steroid, number of steroid courses given last year, if she having allergy to any drug, what other drug currently received, drug induced asthma. Nowadays I took amoxicillin, NSAID, beta blocker. Now, number 7 is family history. Family history will take atopy of the family or in asthma. Any member in the family having similar conditions. Any member in the family having bronchial asthma. How many children you have. Now, number 8 point we take in asthma history, nutritional history. So, how can we take the nutritional history? Any concern regarding her feeding? Does Sarah has allergy to any food? Atopy of patient? Is she growing like her peer? Is she following by any dietitian? Any concern regarding her growth may affected by systemic steroid, poor control asthma. Now, number 9 is allergic history, food allergy, drug history. We also some allergy history also already present on the skin when we take the systemic review. Then we take. No need to repeat any point. What already taken the history, no need to again repeat this history taken. Now, number 10, number history, neonatal history, will ask the any concern regarding neonatal period, not past stool, or he was jaundice, clue of cystic fibrosis, that is. Now, number 11 is that immunization history. Will ask that how about vaccination? Are they up to date? Did Sarah take extra vaccine like VCG, influenza, PCB? Yes, influenza vaccine. Then we'll ask about any immunization history, any extra vaccine Sarah taken or not. Now, number 12 is developmental history. Will ask, do you have any concern about her development, like her peers or not? Now, number 13 is social history. Social history, we first take the environmental history. The triggering factor we will find out. First, smoking. Anyone at home used to smoke? Yes, father. Is he smoking inside the home or outside? Outside. Now, housing, we'll ask. Is it your own house or rented? Recently, did you shift to new house? What type of furniture and type of flooring of the house? Carpet is very important triggering factor for asthma. Did you cleaning the furniture and floor regularly? What substance used in the cleaning? Any new reconstruction at home? How many rooms at home? Is the room well ventilated? Now we'll ask about animals. You have any animals at home? That pet is an important source, triggering factor of asthma. Impact of the disease on patients. What type of sport she performed more? Is the disease affect her exercise or activity? Is she missed school or performance affected? Impact of the disease on family. Who's taking care of Sarah? Any social deprivations? What is job of you and your husband? Is the income satisfy your needs? Any extra financial burden? Any financial support? Transport of and follow up. How can transporting the patient for his follow up? Now, summarizing the history, then what is your biggest concerns? Mother, this time I'm worried because no respond well to inhaler. Last 3 months back, doctor, what do you think is the cause of deterioration? Do you feel there is any agenda we did not cover today? Do you have any questions like that? We end the history of asthma. So this is all about the question we can ask in bronchial asthma history. Thank you.